Understanding what to expect when stopping hormonal birth control can be helpful for both those looking to switch to a non-hormonal method and those who want to conceive. The NC research team set out to answer a common question among those who stop hormonal birth control. How long does it take for the menstrual cycle to get back to normal? Over 14,000 cyclers were included in the analysis. They had stopped hormonal birth control shortly before they started using natural cycles, were below the age of 40, and had logged at least 9 cycles in the NC app. The main focus was cycle length and timing of ovulation, meaning which cycle day, CD, ovulation happened. The first cycle after stopping hormonal birth control was compared to later cycles and to those of cyclers who hadn't used hormonal birth control. The first cycle after hormonal birth control was counted from the day cyclers stopped hormonal birth control to their first period, not counting the withdrawal bleed. So, what did we find? The first cycle after hormonal birth control was on average longer than the following cycles. It also varied more in length, meaning that some cyclers got their period back much earlier and others much later than the average. In the first cycle after stopping hormonal birth control, there were slight differences in median cycle length depending on the type used. 31 days for cyclers who had been on the pill, hormonal IUD, or vaginal ring, 32 days for the mini pill users, and 32.5 days for those coming off the implant. In the second cycle, the median cycle length stabilized for all hormonal birth control types. At that point, it was similar both to how it looked in later cycles and to the median cycle length for cyclers who hadn't used hormonal birth control. More than 80% of cyclers had their ovulation detected by the NC app in the first cycle after stopping hormonal birth control. In the second cycle, ovulation was detected in more than 90% of cycles, and this remained stable going forward, same as for the group who hadn't used hormonal birth control previously. Though most ovulated in their first cycle off hormonal birth control, the timing of that first ovulation still varied quite a bit. Less than 10% of cyclers ovulated within the first 2 weeks after stopping hormonal birth control. Within 2 months, around 70% of cyclers had ovulated, and this increased to 85% by the 3-month mark. Close to 95% of users had their ovulation return within the first 6 months. The type of hormonal birth control also influenced when ovulation returned. Those who used the vaginal ring saw a slightly slower return of their ovulation compared to the other methods. Less than 5% ovulated within the first 2 weeks, 71% within 2 months, and 96% within 6 months. For the hormonal IUD, 11% ovulated within the first 2 weeks, 76% within 2 months, and 98% within 6 months. And these numbers were similar for the pill, mini pill, and implant. Ovulation also generally happens later in the first cycle. The different hormonal birth control types had slightly different medians. CD19 for the hormonal IUD, CD20 for the pill and vaginal ring, CD21 for the mini pill, and CD23 for the implant. However, it's important to note that there are a lot of variation here as well, and many ovulated much later or earlier. The timing of ovulation followed a similar pattern to cycle length in later cycles. By the second cycle, the median ovulation day had stabilized to CD17 in all ovulatory cycles for all hormonal birth control types, the same as for cyclers who hadn't used hormones. In summary, this analysis shows that for most people, their menstrual cycle gets back to normal pretty quickly after stopping hormonal birth control, usually by the first time their period returns. However, there's also a lot of variation between individuals both in the timing of our ovulation and cycle length. Our bodies are different and adjust at different speeds. The first ovulation can happen within a couple of weeks for some, or take several months to return for others, but the majority will get their ovulation back within the first 6 months. Since the first ovulation can happen early, this also highlights the importance of using another method of birth control right away if you're looking to prevent pregnancy after stopping hormonal birth control.